Okay, so
Sure. How you doing today?
Um, oh, okay, I guess.
Doing okay, you guys? Yeah. They didn't give you the Lasix yesterday. Did they say why? Did they bring it up? None? Okay. Well, I was hoping to get some fluid off of you yesterday. And for some reason they didn't give you the Lasix, but okay. How's your walking going?
Well, yesterday I walked twice.
Okay. How far did you make it?
Okay.
First time we went around to there and back. Second time we went all the way down the hall, then back around here and then back, but not completely around.
Yeah.
We did. I think the lady was supposed to come back by this morning and walk her one more time before we left, but I don't know.
Okay. Yeah. It sounds to me like you're good enough to get out of here today. And it's going to be close follow-up with your primary care doctor, okay? And making sure you take your medicines and all that stuff. Your medicines are going to be changed a little bit. You've been through a lot. But all the medicines you should be taking will be on your discharge papers, okay? So just be sure to look at that. And I'll send in your what pharmacy do you use?
Park Street in Calico.
So they're probably closed today.
Oh, yeah.
So do you want Walmart or Walgreens in Mountain Home?
Walmart. Or we can go either way. I'm sorry. Walmart will be fine.
Oh, shoot.
I can go get them.
And what I'll do is I'll give you a month's supply, and then your primary care will send in all the refills. So either one, you'll just go there today, pick up a month's worth, and then go back to your normal one after that. You want? Do you have a preference?
Well, of course, Park Street would be my preference.
Yeah, but we need to get them filled
Yeah.
for today, is what he's saying. He's going to give you a month's worth that we'll pick up at Walmart, and then you can get them at your other pharmacy from there.
Okay. Yeah, we'll do Walmart today. And then, let me write that down.
I already changed it.
Okay, thank you.
Okay, can I ask a few questions?
Please do.
I just want to do the rundown. Okay, so she is taking Ropinirole for her restless legs. When she came in, she was 4 pints low on blood. Is that right?
She did get low.
She had an ulcer that was bleeding.
Yeah.
That was kind of what brought her here, her restless legs, and we thought she had a mini stroke.
Right.
Was that confirmed that she did have it or did not? We weren't sure.
I don't think she actually had a stroke.
Good.
No.
Okay, no stroke.
Yeah.
So, but she was so low on blood, which made her iron low, which could have been causing her restless legs. She wasn't able to sleep. And then she came in here, and then they said they found 2 heart murmurs on her, or I heard that. Is that true?
Yeah. So she has a murmur, and that just means that her valves don't work like they did when she was younger.
Okay.
And that's something that, we watch, and she'll probably need a repeat heart ultrasound
Okay.
in a year.
Heart ultrasound in a year.
Yeah, and her primary care will order that. Yeah.
Okay. In a year. And then she's got that catheter in her. They're going to have to take that out of her today. But they kept saying that her bladder was not emptying.
Yeah.
What is that?
Sometimes that happens when you're in the hospital and you have all these other things going on.
Okay.
But, you weren't having trouble peeing before you got here, and you weren't having trouble peeing for most of the time you were here. So I don't think you need to go home with that.
Yeah.
I think in the short period it was needed.
Yeah.
We had to clear out the urine.
Okay.
But I don't think you need to go home with that.
Okay, so they're going to take out that.
Yes.
And then she's got all those things. They're going to take all those things off of her.
Yeah, that's just watching her heart while she's here.
Okay.
Yeah.
And so that took care of the restless legs, the ulcer, and the heart. And other than she's retaining fluid because of her heart not pumping like it's supposed to, or because of the heart murmur.
Because the heart doesn't work as well as it did when she was 20 years old.
Yeah.
Yeah.
So she just will start retaining fluid.
So I'm going to send a medicine with you
Okay.
to the pharmacy called Lasix, and
Okay.
you'll take it if needed.
take if needed, while needed. Okay.
For retaining fluids, swelling, anything like that.
Okay, and then the lady came in with the breathing treatments, and Helen takes 2 different inhalers for asthma, and one of them is so. The thing is if her ankles swell or if she can't breathe, then she needs to go to the doctor because it could be that she needs a fluid off, right?
Well, again, I'm going to send you out with the fluid pills.
Okay, so that should take care of that.
So you should try taking the fluid pills, and if that doesn't get the fluid off or help with the breathing, then you need to be evaluated by a doctor. Yeah.
Okay. So as of right now, she's pretty good. She just needs to get strong, take her Lasix medication.
I'm also going to send you out on an antibiotic. You're getting antibiotics right now, and you'll just take it until you run out. And you did have a little bit of a increased temperature. You had a low fever, and we started you on antibiotics, and that went away. So I don't know exactly what we're treating with the antibiotic, but you're getting better on an antibiotic.
Yeah, I think they said she had a UTI or something, which is probably from the catheter.
There was concern for a UTI, but the urine didn't show a UTI.
Yeah.
So it's possible. But again, you're getting better on antibiotics, so we're just going to keep those going to complete a course.
So the other thing that had happened was when she came into the ER, she was pooping a lot, like liquid poop almost. And ever since she came in, so you said it had been like 19 days. So the nurse started giving her Imodium, and that kind of helps. But he said only take it if you have diarrhea. Don't take it every day or whatever. So she should take Imodium if she has diarrhea, or
and when you get a lot of antibiotics and all these other meds we've been giving her, it can mess with your bowels, so that should get better with time. In the hospital we're doing all kinds of things. We're giving you breathing treatments, we're giving you stuff through the IV, giving you pills, you're not eating what you normally would, and all the things. It all just adds up and can affect the bowels, so that should get better with time. We ruled out the scary stuff with the diarrhea. So there's no like raging infection or anything like that. So that should get better with time.
So so how does she know if she has low blood and low iron? How would she?
Her primary care will need to check her labs, and you'll need to see your primary care this week. Okay. Yep, this week, and they'll probably go ahead and check your labs, your kidneys, your blood, your everything, to make sure that everything still looks okay. Yeah.
And she needs to make sure and check her iron levels and that she has enough blood. That was kind of the problem, right?
The iron level, not necessarily.
Okay.
We're just going to go ahead and do an iron supplement.
Oh, okay.
And the blood level. So check the blood level, and then that'll be, if the blood level comes up, that means that the iron is working.
Oh, okay. Okay. Okay, I'm sorry, Mama Helen. I was just trying to cover everything, so we got everything.
That's all right.
What, you had a question?
So, in other words, is all this supposed to take care of, or when I say take care of, the restless legs, because that's where all this stemmed from.
And I think all of this stemmed from you having a bleed in your stomach.
Oh.
And that's been fixed. And now you're going to be on medicine to hopefully prevent that from happening again. Okay? And I think everything else just kind of spiraled after that. And you went through a lot, so it's going to take weeks for you to get back to your normal strength, okay? But the important thing is when you go home, to not sit around all day. You need to get up, walk to the bathroom, get up, go to the kitchen, go to the mailbox. Don't go so hard that you're going to fall over and hit your head, but the worst thing that you can do is go home and just sit around.
I know.
Yeah.
I know.
Okay?
Yeah.
And then, like I said, just taking all the medicines that I send in for you, and seeing your primary care doctor to make sure somebody's checking on you, checking your blood levels and all that stuff, and over the next few weeks, you should start be getting stronger. I mean, you're already stronger than you were a week ago.
Yeah.
So that's going to continue to improve, and you just need someone to check in on you, your primary care doctor and all that, and just make sure everything's good.
Okay.
Okay?
So, I need to call and make it appointment.
With your PCP.
Yeah, probably call them tomorrow, or they might reach out to you because whenever you get out of the hospital, it throws a little flag up so that the primary care can see it, and they're like, oh, they're out, so they need to come see me. This is a standard of care thing, so they'll contact you, but it wouldn't hurt for you to go ahead and call them tomorrow just to be sure. Okay.
Okay. So what time should we have people up here to help bring her home?
Let's aim for before noon.
Before noon.
Yeah.
So,
There's no super rush, but let's try to get out before noon. That way we can make sure and go by the pharmacy and get all your stuff.
Okay, so she, as soon as they take the catheter and the stuff off of her, as soon as she feels like it, we can leave.
Yes, and they'll bring you all the paperwork and all that stuff.
Okay,
yeah.
get paperwork.
Your
okay.
discharge papers will have, like I said, all the meds you need to take, and
And take the catheter out and all that.
right.
Okay.
Yeah.
All right, so we'll move at your pace, Mama.
This is so overwhelming.
It is.
But the good news is that you get to sleep in your own bed tonight.
Yes, that'll be nice.
Well, okay.
Any other questions?
No, thank you for everything. We appreciate it.
Questions?
Anything, I think, she's answered, you've answered all of them for her. And
She's concerned about her restless legs, and she's taken lisinopril, which is that the name? Lisinopril that has been
No,
working, or
Lisinopril is for your blood pressure.
oh, sorry,
She's taking ropinirole.
ropinirole. That's it. Sorry.
Yeah.
And is she going to take anything else other than that for the restless legs? That's what she's asking
Not
about.
right
I
now.
think.
The thing about restless leg medication is that it is sedating.
Yeah.
You need to be up and moving.
Yeah.
You don't need to be sedated.
Okay.
well,
So
I only take it when I go to bed.
yeah, and that's how you're supposed to take it. Yeah. So yeah, you take ropinirole at night when you go to bed. If it's not working or you're having problems with it, then talk to your primary care doctor. They deal with restless leg all the time.
Well, the ropinirole works better than anything used.
Yeah. Ropinirole is the best for that.
Okay.
Okay.
Okay. Any other questions? I've got it all here about what you're supposed to do, and we'll get your doctor called and your meds and get you moving around and get you in your comfy chair. I know you'd like that, so we appreciate it. Dr. Elkins, thank you.
Yeah. I'm glad you're doing better. You've been here a long time. I've been with
Is
you
this
through
20 days? 20
I think
days?
today's 20 or 21.
Oh my
But I've been with you through over half of it, and you're way better than when I first saw you.
Yeah.
So that's good.
But, you've been so simply wonderful.
Thank you.
I can't tell you how much I appreciate how great y'all have been here to me. And
I'm glad you're doing better. A lot of the credit goes to the nurses because they're the ones who are in here all day, every day, helping you with stuff. But all right, so y'all take care.
Yes,
okay?
thank you so
And,
much.
be sure to see your primary care doctor this week. Okay.
Okay, thank
All right.
you.
thank you so much.